Maayong hapon, mga binati o pinalangga na kung kaigsuunang Subuanon. Good afternoon to all of those that have made this one of their, shall we say, daily routine if we ever go on live. I'd like to say good afternoon, not just to all Cebuanos that are watching us, but I would also wish to greet all others that are watching us from other provinces in the entire country, as well as those that are in other countries, our brother and sister Filipinos that are OFWs and those that have made their homes in other countries but can never forget the Philippines. I am again on this live broadcast og inyong tagaan ko og lugway mga pinalangga na kong Subuanon nga mag-in-English ko aron masabtan sa tanan ang akong isulti karon. I shall be speaking in English so that I shall be understood by all that are watching me this afternoon. I have decided to come on live again after quite some time because I need to speak up for Cebu. For the past few days, our local papers as well as national papers have been blazing with headlines claiming, like for example, in the Freeman, the third wave in Region 7. And then today, because of course it's always a competition between these two local papers, not to be outdone, Sunstar comes up with double-digit COVID case hikes in Cebu. Now, what is really happening? It is easy to make shocking headlines. These are just words that are printed after all. But it's another thing when we give context, scale, and proportion to these claims. That is when certain claims that what I might call irresponsible journalism will fall flat in light of figures that we present and in light of the scale and context that we will present. And so, what is really happening in Cebu as well as the region? Let me start with a report on the actual situation in the province of Cebu. As of unsa ning pitsaha? As of July 11, our total active cases stand at 690. This may differ from the claim of the DOH because you see their data is often late and often unvalidated. But these are all, every number that I present are all verified, confirmed, and validated. So of the total cases from April 20, 2020 until July 11, 2021, because this is the only disease, I don't know what is so special about this, that we have kept a cumulative total. For all other diseases, we reset. We get the numbers for 2020 insofar as tuberculosis cases are concerned, and then we differentiate that from 2021. But no, not for COVID. We must get this cumulative total. For whatever reason, I cannot fathom. But here it is. Total cases from April 20, 2020 until July 11, 2021 is 17,447 total cases. These numbers are all verified. Of the 17,447, there are recoveries, there are deaths, and so our active cases are pegged at 690. Because of the 17,000, 15,965 or 91.5 have recovered. 91.5%. Deaths pegged at 793, but as I said, it is only here in Cebu that we are verifying. We go to each and every death certificate and check whether or not this person really died purely of COVID or whether COVID was incidental to the death. There's a difference, you know. So of the 793 actual COVID cases, 196. What is the percentage of that? 1.1%. Incidental findings are 565, and these are other causes. No diagnosis yet, there are 32 cases. Of the 690 active cases, those that are in isolation are 519 or 75.2%. Mild asymptomatics, 62.8%. Mild symptomatic, 62.8% or 326. Asymptomatics, 193 or 37.2%. How many are hospitalized? 173. Of which 93 are mild or 53.8%, 41 are moderate or 23.7%, severe are 4, 2.3%. What is others? What is others? Then why did we include that? So see, this skews the data. I'm only talking of COVID. So why are we including these other 35 na that are, so how can we put that this, at any rate, we should just have limited it to the COVID cases. Why did we, so atong gi-appeal ang 173 sa 690, kanang 173, ang 35 ani para for surgery, atong gi-COVID? At any rate, that is the situation in Cebu. At 690 active cases, 35 are actually admitted for other causes, but since it has become the rigor or the standard operating procedure to swab them, they were swab positive. So that's 35. On a weekly basis, because you know, let us have a sense of scale. No? There is a claim here by Dr. Bergere that they have confirmed it. They are seeing double-digit 2-week growth rates in coronavirus disease based on DOH case bulletins. On face value, that is so alarming, double-digit. But what figures are we talking about? If we were to compare it, like for example, a place that has, shall we say, COVID cases of 2, and then the following day there are 2 more, so that's double digit. Is that? It's an increase of practically 100%. So let's have a sense of scale and proportion. Okay, it's quite alarming, double digit. And yeah, special mention, of course, Cebu province, because I know that, well, since we seem to be getting it right here, all eyes are on us. It did not help, of course, that there was this unfortunate pronouncement from the epidemiology department, which was latched on by media, which upon closer analysis, actually, there was no such statement of a third wave. But then, of course, for headline grabbing purposes, you had to put it, third wave in Region 7. And then the following day, to just make an about turn and say, but our critical utilization rate is low. You know, that could have all been contained in one story, but that had to be divided into two because you needed two headlines. Okay, let's look at the total COVID cases landscape in Cebu province. From April 26 last year, you can see that it gradually increased, peaked at 499, went down to 465, went up to 470, and then decreased. It went up again in September last year to 314, and then it gradually decreased, increased to 180, down to the lowest from December 27 to in the week of December 20 to 26. And then there was a gradual increase. We peaked in the total weekly cases at 735. That was in the February 28 to March 6th. Where are we now? We're at 456. You see, that is the nature of this disease. It goes up and it goes down. Are we now to sound alarm bells and churn out headline after headline every time the numbers go up? I have been often repeating this, and I just hope that this will be absorbed by people who seem to be so fixated in reading numbers. It is not about the numbers that increase in testing positive, because you see there are so many false positives. It is about being able to manage COVID-19. I've always said we can never hope to achieve zero COVID, but what we will always aspire for is to manage COVID-19, to contain it, to have a clear referral system, and that our hospitals will have enough hospital beds for COVID-19 care utilization, including critical care. So in this graph, you can see how the cases increased, decreased, and yet in the February 28 to March 6th period this year, were our hospitals overwhelmed? No. Were our isolation centers overwhelmed? No. At around that time, our hospital utilization was at 20%. Isolation was at 5%. Because why? Most of those that are asymptomatic are just either on home quarantine in isolation centers, and those with mild symptoms are able to treat themselves. After having learned from this disease for over a year, it's been a year now. We cannot keep on going back to the time when we knew nothing of this disease. So that is the graph. Anong gilahi maninimong weekly cases na pod April 26? What is this? Okay. Anyway, that is the same thing. Now, what is this? Now, how does the picture look like in the number of active cases? Let's take up the active cases, because this is what is being reported by Dr. Vergeri, that suddenly there's a double-digit increase. These are the active cases now. In the April 26 to 31st, starting from April 26 to 31st, we peaked at 1,530. And that was in the January 15 to 20 period last year. Then from 1,530 active cases, we gradually decreased and hit the lowest at 505. From 505, we went up again to 569, decreased, went down to 240 plus, went up to 350. So you see, it's always a roller coaster ride. Cases increase and then decrease. They increase and decrease. But When we hit 1,530 last year, were our hospitals overwhelmed? In the province, I'm not talking of the city of Cebu. In the province, the answer is no. And when we hit the highest number in 2021 at 1,290, again, in that same period, March 7 to March 13, at 1,290. Were we overwhelmed? No. Were our isolation centers and hospitals overwhelmed? No. Why? Because here in Cebu, we have established a clear referral system. We have established clear containment measures, and we know how to deal with this. We know how to manage COVID-19. So from that period, March 7 to March 13, that's February 26 to March 8, which we peaked at 1,250, we gradually decreased and hit the lowest at 353 active cases. Now we're going up. What's our total number of active cases? It's 695. Shall we start ringing alarm bells and hitting panic buttons? Well, that makes for great inflammatory headlines. But if we are to be responsible at all, it is all about going back to what we have learned all this year, and how to manage COVID-19. We will tell you later. We will show you the actual occupancy in our hospital beds as well as isolation centers. But here is another graph which shows active cases from April 31st to December 31st. This is on a bigger scale, so it's the same thing. So is the next. Well, you might have wondered what are the causes of death. They should have been next to the first presentation. I said COVID is 196, but the rest are community-acquired pneumonia, 197, heart problems, 100, kidney diseases, 63, so on and so forth. But these were pegged. If I recall, dunay namatay diri motor vehicle accident, gibutang lang gyapon COVID. What are the other diseases in the province of Cebu? There's hypertension. There's tuberculosis from January 20 to July 11, 2021. And then there's dengue. Mortality per ratio. Well, the mortality of hypertension stands at 36 per 100,000. COVID is 6, tuberculosis is 6, dengue is 1. Have you ever wondered why our hypertension cases are rising? What happens if you're just cooped up in your house without any exercise at all? You cannot even breathe clean air. And you keep on thinking about the dread and fear that media continues to peddle insofar as COVID-19 is concerned. Other diseases will, of course, proliferate. Here's a graph of dengue, just to give you an example. Lo and behold, it does go up, it goes down. Goes up and goes down. It goes up and goes down. It's still another roller coaster ride. Isn't that the nature of the disease? And yet, do we even talk of dengue now? No, we don't. No one ever remembers dengue anymore. Do we even remember the Dengvaxia thing and the vaccination of Dengvaxia? Nobody talks about it. It's always about COVID, which by DOH bulletin has a 1.76% mortality. This is in the Philippines. You have dengue in Cebu province. This is even a worse roller coaster ride. It goes up, it goes down, it goes up, goes down, goes up, goes down. Nagkatag man ni, nag-ambak-ambak man ta. This should have followed after the first presentation. Now, our COVID-19 hospital bed occupancy. That we have. Because as I said, we have to be careful about whether or not our hospitals can accommodate not the mild cases, because if you start sneezing and you start coughing and you believe you have COVID, you rush to the hospital, then necessarily you will be overwhelming our hospital system. That's why we have a clear referral system here, that from our rural health units to our district hospitals, to our provincial hospitals, before they are even referred to Vicente Soto, we already graph the gradual need to go to Vicente Soto or our COVID level 3 na hospital. Why? Because you have to weed out those that are asymptomatic as well as mild. We didn't know that before. Those first few months, everybody rushed to the hospital at the first sign of a cough or even a slight fever. That overwhelmed the entire hospital system. Now we know better. So, in the province of Cebu, we have 400 beds set aside. Remember, we have 4 provincial hospitals and 12 district hospitals. 400 beds have been set aside. What is the actual occupancy? There are 39 COVID cases, occupying 9.75% of our 400 beds. In the LGU isolation centers, you've probably heard this before, let me repeat this. Just for the enlightenment of those that keep on ringing alarm bells and wishing ill of Cebu. Our total isolation beds are 2,464, with 84 COVID, with 84 in isolation, tested positive. That is equivalent to 3% occupied, leaving 97% of the 2,464 open. Per DOH data, in the entire Cebu Island, we got this from the DOH page itself. There's a total of 1,591 beds available for COVID. Occupancy is now at 624. That is equivalent to 39.2%. 39.2%. Well below the danger zone of possible overwhelming of the hospital system. Bohol, in Bohol, they only have 363 beds. Naturally, with 240 occupied, that pushes up to 66.1%. So you see, we have 624 COVID cases. But since we have 1,591 beds available, the occupancy is much lower at 39.2%. In the province of Bohol, this is the OH data, with only 363 beds available for COVID, and with 240 cases, that pushes up the occupancy to 66.1%. What's my point? It's about having enough COVID beds. It's about hospital system. Because if we increase this number of beds available for COVID to even just double, then necessarily the 66.1% would drop. That is so simple. I am sure that even those that have been ringing alarm bells would understand. The same goes for Negros Oriental. They have only 302 beds available. Occupied is 133, well below our 600 plus in Cebu. But that pushes up the occupancy to 44%. So it's so simple. The more beds, the lower the occupancy, regardless, even if there should be an increase or a spike. It is about hospital management and COVID management. Siquijor, well, let's not talk about Siquijor. Well, yeah, let us talk. They have 66 beds available, 18 are occupied. That's 27.3%. Now, let me just quote this Dr. Vergeri talking about double digit. In Sunstar today, double-digit COVID case hikes in Cebu. Cebu province and the three highly urbanized cities of Cebu, Mandaue, and Lapu-Lapu are all seeing double-digit two-week growth rates in coronavirus 2019 based on DOH case bulletins. Aside from the possibility of more contagious SARS-CoV-2 variant driving transmission, DOH Undersecretary Maria Rosario Vergere on Monday reminded that multiple factors, yeah, we've heard this, usually cause an increase. Mobility, border control, compliance to public health standards. Yeah, it's been a year that we've been reminded. I mean, you know, we do retain this. No? We do have retentive memory. Not all of us are really that dumb. She said they have verified the COVID-19 data in Central Visayas and confirmed that specific areas like Cebu City and Cebu Province are seeing an increase in cases. Okay, yeah, because that's the nature of any disease. Cases increase, cases decrease. By the way, it's influenza season, or have you noticed? Or is influenza still recognized as a disease? Murag, kalimot naman lang ta, it's all COVID. At any rate, even as this becomes such an earth-shaking statement about double-digit increases, why don't we look for a sense of proportion? Exactly how serious and how numerous are these cases in comparison to the population of a particular local government unit. And so we refer again to the Department of Health's own listing of the COVID active cases ranking per 100,000 population. This is the DOH data. And according to DOH, Negros Oriental, with active cases at 3,563, according to DOH, ranks number 1. Because since Negros Oriental has a population of 1,354,995, that averages 263 active cases per 100,000. Bohol is number 4, with a population similar to Negros Oriental, a little lesser at 1,313,560. That, with 1,987 active cases, comes down to 151 per 100,000. But these are separate island provinces. You see, we are not like NCR plus 4 and all these other provinces landlocked in one huge Luzon mass. Where stands Cebu City? Cebu City, with 1,114 cases active, is number 12. 121 per 100,000. Lapu-Lapu City, with a population of 408,447 active cases, 110 per 100,000, that's number 15. Number 18 is Mandaue City. Population of 362,654, 340 active cases. That's 94 per 100,000. These are the Tri-Cities. Number 12, number 15, number 18, according to DOH ranking. Where is Cebu province? Is it in the next page? No. This is from number 23 to number 34. Is it in the next page? No. This is from number 35 to 46. Is Cebu province in the next page? From 47 to 58? No. Where is it? 59 to 70? No. 71 to 82? No. 83 to 94? No. Aha! Cebu province is number 96 because it has a population of 3,226,290 with total active cases. In fact, this is very high at 861. That is too high. As of July 11, we have 600 plus. So I don't know where they got their figures, and they always say we have not yet validated. With unvalidated figures at 861, Cebu province has 27 active cases according to the 861. What if we brought it down to 600? You have the figures, Anak Doc. At any rate, at 861 active cases, it's 27 per 100,000, putting Cebu province at 96. So does that merit headline-grabbing, sweeping statements about double-digit increases? You know what that does? It just dampens the business climate on an economy that is not even yet recovered from all of these ravages of restrictions that have been inflicted upon us. You know, that headline of Freeman claiming a third wave in the entire region, mistakenly presenting a misimpression, caused much damage to the business community. And then we come up, of course, as I said, these two dailies must really compete with each other. We come up with double-digit increases. Please, let's put a sense of scale and balance and responsibility. If not as Filipinos, as Cebuanos at least. Because that is how it stands. I'm not creating these figures. The figures that I presented, where Cebu right now has 690 active cases. That's of July 11. And these are all verified. Even if DOH claims that we have 861, we're still number 96. That's an average of 27 active cases. 27 active cases per 100,000. And more than 90% of that are either asymptomatic or mild. But no, we must have our headlines. So we can proudly show it off that we have our headlines, regardless of who gets hurt. And we are so scared of this. The media continues to spread this fear pandemic about COVID-19. At first, I must admit, in those first few months where we knew nothing of this disease, I was just as scared. And I was the strictest local chief executive that imposed the strictest guidelines and protocols. But it's been over a year. We have figures that have not changed in any way. Mortality continues to be well below 2%. And that's by DOH figures. Let's confirm this by a third party. According to Johns Hopkins COVID Center, they have ranked the countries in terms of number of COVID-19 deaths per 100K ratio. Because that's the way you do it. You don't keep on counting numbers. You consider the population. I mean, isn't that the way it was? Why have we forgotten this? Why do we just continue talking about double-digit increase without even considering what the number of active cases are in accordance with its population? Well, Johns Hopkins hasn't forgotten this, and so this is the way that they ranked it. Number 1 is Peru, with a fatality of 9.3%. That would mean 597 deaths, 597.9 deaths per 100,000. Number 2 is Hungary, with 307.1 deaths per 100,000. Number 3 is Bosnia and Herzegovina with 292. Czechia, San Marino, North Macedonia, Montenegro, Bulgaria, Brazil, Moldova. These are the top 10. Where's the Philippines? Number 96. The Philippines, with 25,921 deaths, is 1.8%. That's 23.98 deaths per 100,000. Other diseases have had higher deaths per 100,000. And yet, we do not keep a daily media broadcast in order to hammer down this mistaken belief that COVID must be dreaded like a virulent disease that can kill half of the population. Figures don't lie. You can refer to the latest DOH case bulletin. Our mortality rate is still at 1.76%. But we must keep on announcing third wave, Delta variant, then the Lambda variant. I recall when I was in UP, there was this sorority called Delta Lambda. I wonder when the Apo variant and the Acro variant and the Tau Gamma variant will be coming out. What is the effect of all of these on the Philippine economy? You'll see for yourself according to PSA data. In 2018, we had a growth rate of 6.3%. 2019, 6%. In 2020, negative 9.5%. Why? Because we told all businesses to close down. We asked everyone to stay at home. So businesses were lost, jobs were lost, livelihoods were lost, and GDP sunk down to negative 9.5%. For what? For a disease that has a 1.76% mortality, a 96 to 98% recovery, but because of our lockdowns and restrictions have definitely caused a more than 100% mortality to our economy. That's a long way to go. From positive 6% in 2019, we crossed that positive threshold and even went down to negative 9.5% in 2020. The inflation rate from 2018 at 5.2 went down to 2.5% in 2019. Went up to 2.6% in 2020, but in 2021, it has now gone up to 4.2%. What is the external debt? Well, you can see for yourself. Right now, it's 98.4 billion. Imports and exports from a high of 112 in 2018 and even just about the same in 2019 at 111, we're now down to 85.69 for imports. Exports are down to 63%. Unemployment. Present unemployment stands at 10.3% from 5.1 in 2019 and 5.3 in 2018. It has doubled in 2020. Underemployment has gone up from 13.8 in 2019 to 16.2 in 2020. What's my point? Surely, after a year, there has to be a roadmap. A roadmap in dealing with COVID-19 and getting on with our lives. We cannot keep on going back to our initial knee-jerk reactions at a time last year when we knew nothing of this disease and we did not have these figures. Why can't we have a sense of scale and proportion? Why can't we do comparative analysis, critical analysis? Why must we keep on focusing on whether there has been an increase of positive cases? Why don't we focus on whether we have in fact improved our hospital system in order to be ready? Should there be what many, well, not many, but some, for some twisted aim, wish would come upon us, a third wave, another surge, just so they could make headlines. Is this how life is gonna be? Is this how we foresee the rest of our lives? Singapore gets it. After careful analysis, Singapore realizes that we can never achieve zero COVID, and this is what I have been saying. Let me read to you exactly what Singapore's game plan is. And I would like to ask those that keep on harping on increases in COVID-19 and because you have not been doing the social protocol, and we've heard that before. But what's the end game and what's your game plan? What's your plan? Are you just to keep on repeating that you wear your face mask and wear your face shields and keep on blaming people because they forget that they are not robots and they are humans after all, and interact with other people? Is that what we will keep on hearing? It's been over a year. We've heard that. We've heard that before. And each time that cases decrease, you pump your chest and claim credit. You, who are so authoritarian over people's lives, and each time cases increase, you blame the people. Look, you've been at the helm. You've been up there. You've been dictating policies. My question is it the time to ask yourselves, why haven't you been able to manage this, and why haven't you been able to come up with a clear roadmap to getting on with our lives and picking up the pieces of a devastated economy? Let me read to you this article. Singapore's surprising new plan to live with COVID revealed. Singapore has announced it will soon fundamentally change how it manages the pandemic. A country that has been one of the world's most successful at combating COVID-19 has announced it will soon fundamentally change how it manages the pandemic. The city of Singapore has stated COVID will be treated like other endemic diseases such as flu. Finally, a city-state that gets it. Well, I'd like to think we got it too, because we've been managing COVID so far. But of course, some personalities would just hope to pounce at whatever opportunity they could to put Cebu in a bad light. Let me just say that we did help them. We gave them ammunition. What with such inflammatory headlines? By what I call would be irresponsible journalism, claiming that a third wave is in Region 7, but of course, focus would be on Cebu. Let me continue. As I said, the city-state of Singapore will now treat COVID like other endemic diseases such as flu. There will be no goals of zero transmission. Quarantine will be dumped for travelers, and close contact of cases will not have to isolate. You know what's happening now? We keep on testing. Someone tests positive, even if it's asymptomatic, immediately the entire family is isolated. A member of media keeps on texting me. They are all isolated. They have nothing, no symptoms, nada, but they cannot work. And while they cannot work, there's no food. So now they're accepting laundry so that they can buy a kilo of rice. You know, it is so fine to talk about policy of isolate every first contact. You forget that most of them are what you call isang kahig, isang tuka. What you earn for that day is what you will buy rice with, what you will feed your family with. And you isolate this person for 14 days. That's 14 days off his income capacity, income making capacity. He cannot make any money to buy for his family's basic necessities. So Singapore gets it. Quarantine will be dumped for travelers, and close contact of cases will not have to isolate. It also plans to no longer announce daily case numbers. We are so fixated on announcing, sometimes with much glee, with much excitement each time, double-digit increase. It seems as though it's all that we are waiting for, so that we can make news and headlines. But Singapore says, announce daily case numbers. Why? Plain and simple. It does not achieve anything. It creates a misimpression because most of these are anyway asymptomatic or mild. So, why the need to broadcast each and every day the number of positive cases that have been tested? You know what they will do? They will just monitor those that are in the hospital, that actually need hospital care. then they will be monitoring their hospital system. Senior Singaporean ministers have said it is the new normal of living with COVID. The bad news is that COVID-19 may never go away. This is what I've been saying all along. You want zero COVID? Maybe it's time for you to go to paradise. There are no diseases there. But for as long as you are in this challenging world of ours, there will always be diseases. You cannot hope to achieve zero COVID in the same way that we have not achieved zero tuberculosis nor zero dengue, zero measles, even though we have vaccination every month, every year. Zero polio, it's made a comeback. And yet you want to achieve zero COVID? And you wait for that day? And in the meantime, we devastate an economy and we put so many people out of work. So, Singapore's Trade Minister Gan Kim Yong, Finance Minister Lawrence Wong, and Health Minister Ong Ye Kung said in an editorial, as I said, the bad news is that COVID-19 may never go away. The good news is that it is possible to live normally with it in our midst, which is what we have been trying to do and we are successfully achieving here in the province of Cebu. We reopened tourism last year when Cebu gained its MGCQ status in July. So it's been over a year now. We are still on MGCQ. Our resorts are full, especially on weekends. But what is the average of positive, active cases? According to the DOH claim of 871, that's 27 per 100,000 because we're 3.2 million. I'm sorry for those that are hoping and praying for a surge or a third wave. That is not going to happen. You know why? Because we have been employing the two-pronged approach. Something that perhaps some people up there should start thinking about. Instead of focusing on masks, face shields, social distancing, stay at home, and all of these authoritarian measures, draconian measures. You know what our strategy is? Boost the immune system. Take healthy foods. Take vitamins. Have enough sleep and rest. Live a healthy lifestyle. Go to the sea. Breathe in without your mask. The sea air. Go to the mountains. Breathe in without your mask. The pure mountain air. It helps your lungs. And it helps boost your immune system. Take in the heat of the sun. That's vitamin D. Sleep at least 8 hours. And please do not sleep with your mask on. You will have nightmares. That's one side. And in fact, you know, those that have been monitoring us have seen we have finished our second tranche of our caravan of government services where we distributed vitamins to all of our frontliners, including our senior citizens, including our PWDs. Free vitamins. We'd rather spend for that because it's preventive. At the same time, we are encouraging them to plant vegetables with our Sugbusog program so that in any household, you can have the healthy, green, leafy vegetables that you need, as well as others, tomatoes, fruits, and whatnot. What's the other side? Use science and technology. Use air purifying systems with HEPA filters, UV, ultraviolet, sterilizer lamps, personal air purifiers. These are now available, you know, at very, very affordable prices. That's what we're doing. We do not keep on repeating social distancing. You are not face mask with face shield. No gathering. We've heard that before. But has it achieved anything? Do you have a model to show as a successful implementation of your so-called protocols? And in fact, it brought down the spread and transmission of COVID-19. But as I said, what I've noticed, whenever cases drop, you take the credit. You, who have appointed yourselves as the gods over people's lives. And when cases increase, you blame the people. I have a model, the province of Cebu. In spite of what Dr. Vergeri said, that we have double-digit increase, hello, according to your figures and your own data, we are ranked number 96 in the total number of provinces and cities in the active COVID case incidents per 100,000. Because you see, we're the most populous province at 3.2 million. We've been able to manage it. But I never said, go back to all of my other broadcasts. I've never, ever dared to say, I will achieve zero COVID. No. All along, I've been saying it's about COVID management. And the most important part of that is prevention. Is the wearing of face masks and face shields the only way of preventing? We've been wearing face masks for a year and face shields for a year. Have you been able to, well, since those are your protocols, perhaps it's time for you to say we are successful. See, our cases are going down. But now you talk about Delta variant and Lambda variant and Delta Lambda. Sorority na sa UP. But we have a model because we started that last August with my Executive Order 20 and 20-A. We defined for each and every tourism activity the specific protocols that had to be followed. And it was always, and as it continues to be, a two-pronged approach. Boosting one's immune system and using science and technology. It's as simple as that. And no matter how much you may wish that Cebu province will stumble and fall, no, I will not allow it to. I am here. I am staying here to defend this province and see to it that this will continue to be a model for the entire country, for others to see that after all, it can be done, that we can do it right. By the way, coincidentally, Singapore's population is 5.7 million. The total population of Cebu is 5.1 million. That's one similarity. Second similarity, we have no other agenda but the welfare of the people. Singapore is known for its very efficient, professional, and corruption-free kind of governance. We strive to do the same here in the province of Cebu. According to these three ministers, Minister of Finance, Health, and Trade, the virus will continue to mutate and thereby survive in our community. And so are we going to jump at every possible variant that you suddenly, by genome sequencing, discover? That is the nature of all viruses. They mutate and mutate and mutate. And there will be variant after variant. I am really waiting. We now have the Delta Lambda. I am waiting for the Tau Gamma Rho variant. It says here, Singapore never got to zero. Now doesn't want to. Like most countries, Singapore had an initial peak of cases last year, topping out at 600 cases a day in mid-April. Following a smaller wave in August, COVID-19 hasn't cleared up since. However, the nation of 5.7 million has had a steady undercurrent of 20 to 30 cases every day. The nation has recorded 35 deaths in total because they have an excellent health system and they have an honest assessment of true and real COVID deaths, not including motor vehicular accidents. Singapore has strict border controls in place with most countries, including tests on arrival, hotel quarantine, and stay-at-home orders. It's not dissimilar to Australia, which, by the way, some of you wish to always cite. See, Australia has lockdown, we should do the same. But Singapore varies the demands on travelers depending on the risk. But, this is more important, but all that would be eventually done away with under the plan put out by Ministers Kung, Yong, and Wong to make up Singapore's COVID-19 multi-ministry task force. Every year, many people catch the flu. The overwhelming majority recover without needing to be hospitalized and with little or no medication. And that's what's happening also with so many. Those of you who are watching me now are aware of this. Even you yourself, you have had some symptoms and you recover with little or no medication. But a minority, especially the elderly and those with comorbidities, can get very ill and some succumb. That's with the flu, that's with other diseases, because that's life. There will always be deaths. But I am just wondering, nobody cares if someone dies of a heart attack or someone dies of a vehicular accident. That doesn't get posted on Facebook. But when someone dies and says it's COVID, it's splashed all over. Is it because someone who dies of COVID is more important? Or it serves the agenda of some? According to these ministers, we can't eradicate it, but we can turn the pandemic into something much less threatening, like influenza or chickenpox, and get on with our lives. Instead of monitoring COVID-19 infection numbers every day, we will focus on the outcomes. How many fall very sick, or those that can now be categorized under severe and critical? How many in the intensive care unit? How many need to be intubated for oxygen, and so on? This is like how we now monitor influenza. So I ask the powers that be, those that come up with these daily updates, like Dr. Vergere, what's your game plan? What's the end game? What is your roadmap towards graduating into a new normal? Are we going to continue to focus on chalking up numbers and talking about variants and doing a back and forth for quarantine classifications, atras abante? Or isn't it time that we take a cue from Singapore, where Singapore has stated that they will live with COVID? Well, this is what we've been doing all along here in the province of Cebu. I have seen the suffering of so many, precisely because of the restrictions of COVID, not because of COVID, but because they have lost their livelihoods, and their jobs and their businesses. And I cannot allow that to continue to happen to my beloved Cebuanos. So I'm going to take a cue from Singapore. It bears notice that this island state, this city-state, is showing the world how to live with COVID. I hope that puts to rest this issue. Let me repeat, we're managing COVID here in Cebu. We've learned from all that has happened in this over a year learning period. If at this point we keep repeating the same tired old phrases that we've been saying at the start of this pandemic, then it's either way, you haven't learned anything, or you wish for COVID to continue till kingdom come. And if that is the case, then there must be another agenda. Where's my cup? So, my beloved Cebuanos, let me repeat this. Haman ang kuan, unqualified opinion. And I hope this will finally put an end to all of these questions, in spite of the presence of tarpaulins that some people have spent money for. As I said, please don't waste your money. I will stay here. If you still want me, I will run again as governor of Cebu. I cannot let go at this point, especially when I know that there are others that would wish to see Cebu fall and stumble. I will stand up for you, Cebuanos. I will protect Cebu as your governor. And in that light, let me announce, I thought, we wanted to keep this, this didn't need to be announced, but since other LGUs are announcing already, left and fourth, left and right, we got this notice last February pa. Just to tell you, we did not need to publicize it, but I guess to give you also, Cebuanos, a sense of confidence and security, and to inform the rest of the country how Cebu is being managed. This is the Commission on Audit Annual Audit Report on the province of Cebu. And this annual audit report for the year ended December 31st, 2020 states that Independent Auditor's Report, Honorable Gwendolyn F. Garcia, Governor, Province of Cebu, unmodified opinion. We have audited the financial statements of the provincial government of Cebu, which comprise the statement of financial position as at December 31st, 2020, and the statement of financial performance, statement of changes in net assets, equity, statement of cash flows, and statement of comparison of budget and actual amounts for the year then ended, and notes to the financial statements, including a summary of its significant accounting policies. In our opinion, the accompanying financial statements present fairly in all material respects the financial position of the province of Cebu as of December 31st, 2020, and its financial performance, its cash flows, and its comparison of budget and actual amounts. We conducted our audit basis for unmodified opinion. We conducted our audit in accordance with international standards of supreme audit institutions. We believe that the audit evidence we have obtained is sufficient and appropriate to provide a basis for our unmodified opinion. So, this is for you, all of our constituents in the province of Cebu. your government is being managed well, faithfully, in accordance with the oaths that we took to serve you. An unmodified opinion from the Commission on Audit for our financial performance for the year ended December of 2020. So let me join others that have earlier also presented their own accomplishments. On a lighter note, I would like to thank, about 2 weeks ago, I was in Ormoc to visit Congresswoman Lucy and Mayor Richard. And I would like to thank them for their kindness and gracious hospitality that they showed, and to thank them for this beautiful, beautiful cup. Asa man tong naikuan dito? Haman to? Katong naay recipe, na dito recipe on garlic, na diha katong sud sa box. Na dito. Congresswoman Lucy also subscribes to the healthy way of living and an effective tool in management of diseases. They have beautiful, naa dito sa lamisa tanawa be. And about sa kalachuchi, there are simple recipes like combining lemon with ginger and turmeric. Mama na, this is exactly what we have been prescribing. And di lang ko maingog tuog kay naana po ni ini they will go ballistic. So steam inhalation. So this beautiful, beautiful cup with kalachuchi, the national, the symbol of Ormoc is the kalachuchi. Yeah, covered in cozy. This is the recipe for. This is comfort in a drink. Ginger, lemon, turmeric, and water, sweetened to taste with honey. This is for tired days, weary souls, and even broken hearts. So, kung sakit imo kasing-kasing, kay dunay nagpabuak ni anang mao kasing-kasinga, naay pag init og tubig, butangi og ginger, butangi og lemon, turmeric, unya, imna. Wa na magsakit akong kasing-kasing. It heals the soul. So thank you very much, Kong Lucy and Mayor Richard. Shout out to my dear friends in Ormoc, Dodong Suarez and Dr. Liza and Boy Laurente and Tessie Chua. It was so good to get together with you after such a long, long time. So this ends our broadcast. I needed to present once again the clear, unadulterated facts that are backed with actual data insofar as Cebu Province is concerned. My only plea is that as Cebuanos, let us help each other. There are other forces outside Cebu that would wish ill upon us. Let us not give them ammunition. It's difficult enough warding off these forces. It will be much worse when we ourselves give them the daggers to stab ourselves with. Naot unta sabot mo ang mga nahintungdan. Okay? No more questions?
Okay, question, Charmaine.
Yes,
Yes.
Gov, mind gabi. Nakabalo na baka Gov nga nainigawas nga survey nga gihimo sa RP Mission and Development Foundation nigula Gov no nga you are the top performing governor and Inday Sara is also the top performing mayor. Unsa imong basulti?
Asa man na, kisa man na nag-survey.
RP Mission and Development Foundation is an independent non-commission survey.
Oh yeah?
It was na Manila
Manila
Times.
Manila Times.
Manila Times?
Mhm.
Well, giunsa kisa may ilang gi-survey. Basig
77%.
basig ako ra ilang gipangutanan. Nya ako. Bitaw giunsa man nag-survey? Kisa may ilang gi-survey.
77% ang imong lead
Ay, mo
and
positivity
actually
rating.
positive,
or-
yes.
oh.
And also the mayors also. Ano po nila?
Yeah, well, thank you for informing me and naana sa Manila Times, so a very credible paper. So, well, thank you and thank you to the kisaning outfit,
RP Mission and Development Foundation.
RP Mission and Development Foundation, for conducting the survey. But I don't want to take personal credit for it. I'd rather hope that this recognition would, in fact, recognize Cebu as the top performing province in the country today, because we're doing the best that we can, and the Cebuanos are such a great people. They have been able to withstand all adversities in the past, and we are showing now that we are doing it right here in Cebu.
Congratulations.
Thank you.
Okay na.
Okay na.
Yes.
Okay na. No, dili na wala na. No more questions. Go.
No more question.
Oh.
No more?
Nag-hisgot naman siya sa COA. That's it.
Sa GPM.
Ano sa to?
Okay na to. Wala
Okay.
na question. Okay na to. Parting.
Writing na.
So, thank you. All of you that have stayed throughout this entire broadcast. Daghang salamat sa ako mga pinalanggang Subuanon. Inyong kasaligan nga ni ako kanunay barugan ko kamo o dili ko kamo biyaan. Labi na taliwala ni ining atong mga giatubang. Di na lang ko moingon taliwala sa pandemya, apan taliwala sa ubang buot nga muguba kanato. Atong ipadayon kining atong kahiusahan kay aron mapakita nato sa uban sa tibok nasod nga di ay mahimo sa usa ka katawhan nga magkahiusa ug mahimo nga makabarog bisan pa sa mga kalisod. Ato ra gihapon kining tanan nga masumpo. Daghang salamat kaayo kaninyong tanan. Thank you. Mabuhay ang Cebu. Mabuhay ang Pilipinas.